Hey guys, it's Nikki here. I'm here today to do just a quick video just about something that's pretty close to my heart, and that has to do with my job. I had already filmed this, and I looked at what I had filmed, and I was a little unhappy with it, mostly because I talked for like 40 minutes about my job, and it doesn't need 40 minutes of explanation. So now I've written an actual script, and I'm gonna try again. So this video is coming out on May 13th. That is National Cytology Day. And the important thing with National Cytology Day is that I work in cytology. We like to celebrate this day. And what is cytology, you ask? It is a field in the medical lab, at least I work in the medical lab at the hospital, and what we do is we help screen PAPs for lesions in cancer, and we screen other sites for cancer. So moving forward, I'll talk about my gynecological specimens, or the Gyne specimens as we call them shorthand. And those are pap smears, so it's related to the cervix of the uterus. And then when I move on, I'll talk about non-gynecological or non-Gyne specimens. And those are specimens kind of outside the female reproductive tract. They do include things like the ovaries, but they include a lot of other sites like lymph nodes, thyroids, pancreas, small intestine, stuff like that. And so my job, kind of summed up, is cancer detective, because we look at a specimen on a slide and look at it on the cellular level, and we look for lesions, the presence of a benign tumor, or the presence of a malignant tumor, which is cancer. So I'll start with Gyne, which, like I said, is pap smears. Kind of the practice in the US and Canada is for women to go every 3 years after they become sexually active, which turns into, I believe, a 5-year cycle farther down the road once they're kind of out of the high-risk age groups. Although this being said, the 3 years is most effective for places that have reflexive Hpv testing. As a doctor, I can't really recommend anything, but I personally like to go for pap smears every 2 years rather than every 3, and it's just a frequency thing that makes me feel a little bit better about my cervical health. Almost everywhere, including the hospital and I work at in the province I live in, usually has a screening program of some kind. Like I said, for us, it's every 3 years. Other places in the world, it's different. But the point of doing the screening program is to have patients come in frequently enough that we can catch a lesion before it becomes cancer. Because our diagnoses, there's kind of like a scale. We have normal, low-grade lesions, which means it's atypical, and it's usually related with an HPV infection. High-grade, which is closer to cancer, also usually related to HPV, which is why Gardasil was such a big thing when it came out. And then we have cancer, or suspicious for cancer. And while you have, there's 2 different cell types that we diagnose off of, being squamous, which is more like skin, or gland cells, which have a slightly different appearance. They both can go through kind of this low grade to high grade to cancer transformation. Once programs like the screening program came into effect back when Papa Nicolau popularized it, the women's death rate due to cervical cancer dropped dramatically because we were catching it when we could cut a lesion out, and no other treatment would be necessary other than follow-up to ensure that the lesion stays gone. Along this line, just to let you guys know, if you ever get an atypical pap smear, there's specific follow-up procedures that we follow, and that's usually, you get a follow-up pap to see if, some lesions can be not sloughed, but can be scraped off just by getting a pap because they're very superficial. Others are not. And in the case of both, typically you'll also get biopsies done, which is where they take a small chunk out of your cervix to look at the cells there and see, is there a lesion there? And if it is, how high grade is this lesion? How much closer to cancer are we concerned it is? And just lastly, in the places that have it, we also do HPV testing. My province is currently not one of the ones with HPV testing, unfortunately. That being said, we're hopeful we'll be getting it in the future because in conjunction with PAPs, it's just really effective. Although I'm sure many of you watching have had pap smears before or have been told about pap smears. But for those who aren't familiar, you have a speculum inserted to keep your vaginal canal open properly. The cervix is visualized, and then a sample is taken from it. And my job is the sample from the cervix is either then put on a slide for us or sent to us in a container of fixative, where it is then processed and put on a slide for us to look at. And so my job is to sit at a microscope, look at these slides all day, and to find out who has lesions, who doesn't have lesions, and anything that is a lesion or in a patient who used to have a lesion will get sent on to a doctor to be looked at, specifically a pathologist. And so when we're looking at a slide, we're looking at the cell. So we're looking at the nucleus, we're looking at the color of the nucleus, like how dark it is. We're looking at how smooth the nucleus is. We're looking at how big the nucleus is in relation to the rest of the cell. We look at the background. We look at the smear pattern. And there's just a lot of things that we look at to get these diagnoses from. And like I said, anything abnormal gets sent on to a doctor who is better trained in terms of, I guess, identification. We're just the initial step to see if there's something wrong. And so that's my job. And I think it's really important, and I take a lot of pride in the service that it provides. I highly encourage women to go regularly, to talk to your doctors about your cervical health, because it can become a big thing really quick if you're not careful. And we have screening procedures in place to help catch things as early as possible. That being said, some things still do get through. The people looking at these slides, including myself, are only human, but that's why we have the screening program, and it to help minimize human error. And so if anybody at this time watching this video is struggling with symptoms that they're not really sure about, if you're having colored discharge, like colored vaginal discharge, if you're having pain, if you're having postcoital bleeding, if there's anything weird and not normal going on down in your vagina, talk to your doctor and get it looked at. Because it could be something that we catch early, it could be nothing, it could be a yeast infection. It doesn't matter. It's something that we could probably get figured out for you. And so if you ever have concerns about stuff like that, talk to your doctor. And that's the Gyne. Now we'll move on to the non-Gyne. Like I said, these are specimens where the source is outside of the uterine cervix. And these are more targeted specimens. So unfortunately, with specimens like this, we do typically see a lot more cancer in them than, say, with the PAPs, but that's because it's a screening program versus a targeted sampling. And so we collect these in a variety of ways. One that's really common is called a fine needle biopsy. They take a very, very tiny gauge needle, put it in the organ of interest, move it back and forth to get some cells, and we make slides out of it. And with that, from there, we can diagnose, is it a malignant tumor? Is it a benign tumor? Like, we can kind of give doctors an idea of what's going on without having to resort to surgery right away. So even though getting poked with a needle might not sound like it's that non-invasive, it is compared to the other choices. And two other common sources are urines and fluid drainages from your body cavities, like your peritoneal or your pleural. Like I said, these specimens do often have more cancer, but it's often because they're more targeted. And when we're finding cancer, we're getting patients the treatment they need and not have, or if there's nothing there, they're not going through you guys aren't going through unnecessary procedures to find out nothing's wrong. It's really important here too, if something weird is going on, talk to your doctor about it. Go through, see what tests you can get done. If you catch it early, your chances are so much better. And with that out of the way, I'm just going to do a final section here of things I want to impart to you. It really benefits you to be a little bit more in tune with your own body, so paying attention when things seem out of the ordinary or abnormal, and talking to your doctor about them when they come up. Try not to put it off unless you're sure it's something that will pass, because it can be your outcome can depend greatly on how early some things are caught. If there's something wrong and a doctor isn't necessarily listening to you, don't be afraid to advocate for yourself, and sometimes that just means going to another doctor to get a second opinion where that's possible for you to do so. And unfortunately, sometimes, especially with women, sometimes you just have to push a little bit harder to get yourself heard. It's unfortunate and it sucks. I've had to do it. I had to do it about 10 years ago and it sucked. And even at 18, 19, I knew it was important that I still had to push through because I ended up having a pretty significant health issue that was really impacting my overall health in general and still somewhat impacts it today. I wrote, if you own a cervix. If you have a cervix of your own, this is specifically in terms of the Gyne and getting pap smears done, please, please, please go regularly, because treating your body well and getting it looked at and staying on top of these things can really, really help you down the road. With that, I'm going to leave this here. I've talked long enough. This is about half the length of the other one, but it's still really long. But I'm going to leave that you guys here with that. If you have any questions about my career, if you have any questions about some of the more if you have any questions about more details about my job, I'm willing to answer them. If you have questions about cancer, about your cancer, I can't answer those. You have to go to a doctor. My level of knowledge in the profession is limited to being the initial diagnosis and flag for stuff like that, not necessarily the treatment. So with that, I will leave it here, and I will talk to you guys in the comments. Peace.